We can take even a child who has an abscess in the liver and percutaneously drain it, and it saves the child from this open procedure, which always has greater morbidity and mortality than doing something percutaneously. As a matter of fact, this whole thing of interventional radiology developed in the same 3 decades that minimally invasive surgery and endoscopic surgery started. So the idea is do the least you have to, do the least amount of damage possible to get the job done. Breast, we see so many things on mammography that require a biopsy, and so we can just take a probe and see the actual needle going into the mass so we know we got it, and that saves from this. And I used to see so many of these open procedures, and remember, biopsies of the breast, if you're doing it properly, about 80% will be benign. If you're getting 100% malignant biopsy results, you're missing cancers, because you're only biopsying the abnormalities that are absolutely obviously cancer. If you're getting 5% malignancy, you're biopsying anything that walks into the office, which is incorrect. So the perfect amount is 80%, so you don't want a bunch of scars in your breast for benign disease. We can use CT guidance to put a needle and biopsy pretty much anything and avoid open surgery. Here's a mass. You can see the needle going into it right next to the spine. There's that soft tissue mass. The lungs are on either side, and this is what you avoid with this. Okay, eliminating surgery. Always what we do, eliminate surgery. Here's a biopsy of a kidney, and that eliminates having to open up the flank and do the biopsy in an open way. Again, more morbidity, more mortality. When you get a stroke because your carotid artery gets so narrow and a clot develops and it embolizes, and that's an issue. And you can see that little narrowing. See, this is a carotid artery going up into the brain. You see where it gets very, very narrow there? Well, radiologists, interventional radiologists, invented angioplasty and stent placement, where you put the balloon catheter in, you blow it up, and then the stent will keep it open, and you get a full-on good flow to the brain, and you avert the likelihood of a stroke. That's the surgery that you avoid, where they basically just cut your neck open and do what's called an endarterectomy, which again is very invasive, and I'd rather have this than that for sure. Coronary artery angioplasties and stent places are very important. You can see that little narrowing there. Well, it's all completely open after this balloon was used, and this is Dr. DeBakey, who kind of invented coronary artery bypass grafts in Houston. And you know, it's an open procedure, and again, you're going to get sicker getting this to help you than the less invasive procedure that's done percutaneously.